After performing a surgical scrub as described in a previous video, you must put on sterile gown and gloves. This video will explain how to apply your own gown and gloves if you do not have assistance. First, you must dry your hands. To dry your hands, grab the sterile towel you previously arranged by its corner, trying not to drip water onto your sterile gown or gloves. Use one side of the towel to dry your left arm from the fingertips down to the elbow, taking care not to touch the unsterile portion of your arm or your clothes. Do not go back to your hand once you have begun drying your arm or elbow. Then use the other side of the towel to dry your right arm in the same way. After drying your hands, use Hexasol on your hands and wrists. This is the last step in sterilizing your hands. Do not touch your elbows or upper arms. Once the Hexasol is rubbed in, you may grab your gown. Take care not to contaminate your gloves. Only touch your gown. Unfold it away from your body, holding the collar up. Only touch the side of the gown closest to you. Insert your arms into the sleeves, but keep your hands within the sleeves. Have an assistant tie the back of your gown closed. You can hand him or her the straps from the front of your gown to reduce the risk of contamination. Putting on your own gloves sterilely is quite difficult and takes some practice, so do not be frustrated if it is quite awkward or not successful the first few times. To apply your gloves, carefully open the package. Note the position of the gloves in the package. They are placed with the right glove on the right side and the left glove on the left. The fingers of the gloves are pointed toward the top of the package and the thumbs are on the top side. Carefully pick up the right glove, using your left hand through your gown. Lay the glove onto your right forearm backwards, with the thumb facing down and the fingers pointing toward your body. In other words, the opening of the glove is facing away from you, as is the opening of your gown's sleeve. With the right glove resting on the right sleeve of your gown, grab the bottom of the glove's folded edge with your right hand through the gown. Then, grab the top of the glove's folded edge with your left hand. Pull the glove with your left hand, stretching it over the end of your sleeve so that it fully covers the opening. If done properly, your hand's bare skin should never be visible. Pull the cuff of your glove down your arm as you push your hand forward, out of the sleeve of your gown and into the glove. You may not be able to place all of your fingers immediately into the fingers of the glove, and that's okay, as long as your entire hand and wrist are covered by the glove. Adjust the glove as necessary, but note that the positioning does not have to be perfect to proceed, because it will be easier to fully adjust the glove later once you have the other glove in place. Now grab the left glove from the package. Similar to how you apply the right glove, lay the left glove on the left sleeve of your gown, the thumb down and the fingers pointed toward you. Using your left hand through the sleeve, grab the bottom folded edge of the glove. Using your right hand, grab the upper folded edge of the glove. Pull the cuff of the glove over the open end of your sleeve, and then tug the edge of the cuff down to your forearm as you push your hand forward into the glove. Adjust the fingers of your gloves as needed. You are now ready to begin your sterile procedure. Have an assistant remove the sterile drape from where your gown and gloves were placed so that it does not inadvertently get used again for the next patient. This process of putting on your own gown and gloves while preserving sterility is very challenging. It takes practice to do it well, and even more practice to be able to do it quickly. However, the process is extremely important. If you contaminate yourself in the process, you must start over again from the beginning of the surgical scrub. Otherwise, you will put the patient at risk of developing a surgical site infection.